Hi everyone. Oh goodness, what happened there? Hi everyone, welcome back to the Dr. Sia channel. In this video today, which is the second video in a series where we're looking at how self-criticism operates within people who have a ambivalent attachment, disorganized attachment, and avoidant attachment. Now, if you haven't checked the avoidant attachment video already, please make sure you do that and I'll link it up here for you somewhere there. But this video is going to be about ambivalent attachment. So let's get started. All right, so how does self-criticism operate in a person who has an ambivalent attachment? Now, if you're an ISTDP therapist or a therapist of any other kind, you've definitely come across self-criticism in a patient before. But you might have not thought about, well, if you're a non-ISTDP therapist at least, you might have not thought about how that self-criticism operates differently within people who have an avoidant attachment and people who have an ambivalent and disorganized attachment. So in a sense, what we talked about last week with avoidant attachment is that self-criticism is about making sure that externally people believe things about you, or that you look at least better in terms of like more successful, for example, than you actually are. So the self-criticism pushes you, really forces you to look better than you are. So what about ambivalent attachment then? What is the self-criticism really trying to achieve? And one of the primary things that the self-criticism is trying to achieve in ambivalent attachment is to make sure that the person, in a sense, does right by other people, that they are taken care of by other people. So the self-criticism will kick in any circumstance or situation where the person has not been good enough to other people, where they haven't been caring and kind and empathic enough to other people, caretaking enough of other people. Often self-criticism in ambivalent attachment is paired with self-sacrifice, and when they haven't been sacrificial of themselves enough, then the self-criticism will be kicking in. And so all of these sort of mechanisms are really there with ambivalent attachment to criticize the person, to keep them in a position where they do not do, say, or suggest anything that might get them abandoned by other people. So in a sense, the self-criticism will kick in for them if they say something inappropriate or do something inappropriate or say something that people might find is too much and then might abandon them about, or like if they're not interesting enough, if they are not pleasing enough, if they are not able to keep people there enough, if they are not able to keep enough attention on them, then people will sort of lose interest in them and then they'll move on. So then they'll be sort of critical about themselves that, oh, I didn't pay enough attention to people. I wasn't as energetic as I needed to be. I wasn't as pleasing enough. I wasn't as funny. I wasn't as nice as I needed to be for people to hang around. So that's really what the self-criticism in ambivalent attachment is about. And you can hear there's a clear difference there. I hope you can hear the clear difference between that and avoidance. And if you really don't know the one with avoidant attachment, go and check it out and you'll hear a really big difference between how it happens in ambivalent and in avoidant attachment. So whether you're watching this video because you want to help a patient better, or you want to help yourself better, or you want to get to know somebody you know better, what we're looking at for self-criticism in ambivalent attachment is this idea that obviously with ambivalent attachment within themselves, there's this idea that they are never enough, that they somehow, are incompetent or not enough to take care of themselves, that they somehow are flawed, right? So with this idea comes then, well, okay, well then what I need to do is make sure that people hover around me. And the way that I can do that and take care of me, and the way that I can do that is to be nice to them, kind to them, smart, caring, so that they sort of decide to stay around and then they can take care of me. Now, what happens is, while this successfully does that, and people who have an ambivalent attachment and are critical will tell you that they have a lot of people around them, that they have a lot of friends, they have a lot of support. And so it is successful in that sense that they do attract a lot of people to take care of them. But at the same time, deep within, there'll still be this really big sense of, I am incompetent. I cannot do things. I am unable to do things by myself. I need people to be there around for me. So they become dependent on other people and really become not dependent at all on themselves, because to depend on themselves would be, well, essentially they just fail because they can't do it themselves. So I hope that that helps you understand the difference there in self-criticism between avoidant and ambivalent attachment. And then in the next video, we're going to be looking at disorganized attachment and what self-criticism is about there. I hope you enjoyed the video. Please do subscribe. Let me know what you think. Comment. Press that bell button so I pop up on your telephone when you are doing nothing else. You might be asleep and then I post the video and suddenly I say, ding, I'm here. Turn on the, I was going to say turn me on. Turn on the video and check out my ISTDP logic on things. Anyway, I hope this helped. I hope this was reasonably a good video to you. Let me know if there's any topic that I can post on that you would like to learn about. Maybe you're a student of ISTDP. Maybe you are a psychologist who likes to perv on these videos and see if you can work better with your patients. Just let me know. Just post something in the comment and let me know what you would like for me to talk about, and I'm happy to do that. Either way, thank you so much, and I'll see you next time.